So you've started an antidepressant and you're finally feeling like your normal self again. But now you're wondering, how long should I stay on my medication for? Well, in this video, I'm going to be answering that exact question. And make sure to stick around to the end because I'm also going to fill you in on what happens to your brain if you're someone who has untreated or poorly treated depressive episodes. One of the biggest mistakes I see patients make is stopping their antidepressant medications too soon. So many people think that they should stop their medications the minute that they start feeling better, right? It did what it needed to do. Now I don't need to be on it anymore. And this is wrong. What I tell my patients is that once your symptoms have returned to baseline and you're feeling back to your normal self again, this is when the stopwatch starts. From this point on, you want to stay on your current dose for at least another 6 to 9 months. And if you continue to remain symptom-free during this time, then we can talk about getting you off of your medication. The reason behind this is that if you pull that medication too soon and prior to the 6 to 9 month mark, you're at increased risk of your symptoms coming back again. And the evidence shows that continuous treatment with antidepressants decreases the odds of a depressive relapse by 2/3. And we know that the risk of relapse is the greatest in the first few months after stopping a medication. This is important when studies have shown that up to 40% of patients with major depressive disorder will have a recurrence within 2 years, and 85% will have a recurrence within 15 years. Now, does this time requirement change based on the number of depressive episodes you've experienced? Before we dive into answering this question, make sure to check out the link below if you want to download my free antidepressant beginner's guide, because in this, I answer your most common medication questions in addition to breaking down the pros and cons of the top 10 antidepressants that are currently being prescribed today. So if you're looking to feel better faster, this is definitely something that you'll want to take a look at. Okay, so if you've had multiple depressive episodes, the answer is yes. This 6 to 9 month time requirement changes. There's evidence that you'd benefit from maintenance treatment for at least 2 years, if not longer. Now, you might be wondering, what's the big deal? Is there a long-term risk of me having multiple depressive episodes? Some studies are now suggesting that there's potential for depressive episodes to cause changes in your brain. And specifically, what we're seeing is a loss of volume in the hippocampus. And this is the structure that plays a role in your learning, emotional responses, and memory. And this reduction in volume has been shown to be directly related to the number and the duration of untreated depressive episodes that you've had. And not only are we seeing changes in its size, but we're also seeing changes in its functioning, meaning that people are having increased difficulty with cognition, particularly with memory loss. So we want to help you with both achieving symptom reduction and with preventing symptoms from popping back up again, because trying to reverse these changes in your brain's architecture and functioning could be difficult. Not only that, future depressive episodes could potentially last longer, be more intense in severity, and be more resistant to treatment. So please do not go off of your medication without talking to your doctor first. Now, if you're at the point where you feel like you want to come off of your medication, but want to learn more about whether or not you might be at high risk for those withdrawal symptoms, make sure to click that top video.